Hello, welcome back to my channel, and hello if you're new here. My name is Hannah, and today I just want to talk to you about C-sections, my experience on a C-section. Obviously I'm hoping not to have a C-section this time around, but it's always good to just get another mum's point of view or experience of what happened in their C-section. So this is my C-section story. And any advice and tips I can give you. You have to bear with me though, because I'm out of breath. I'm 38 weeks today, and I'm going to try for another VBAC. And I'll be doing another video on VBACs shortly as well. So I had to have a cesarean section because my baby turned breech. So breech is where their head's up here and their legs are down the bottom, and that's not what you want. You can give birth like that, but it is more difficult and challenging. They advise to turn, like manipulate the baby and try and turn the baby with like their hands. They'll try and move your belly and your bump. But for me, I didn't want to risk that. It can work, but not always. And sometimes it can put stress on the baby. And cause more complications, but then sometimes it will work and be absolutely fine. Disclaimer though, I'm not a medical profession, so don't take any of this, literal sort of thing. So always contact your midwife and doctor with any of this sort of information, but this is my point of view and what I read up. So I didn't want to risk the whole moving her. And she didn't want to turn right up until I think I was 39 weeks they left me till, and 5 days or something like that. So we still had to go for my cesarean section, and that was fine. The main things I would say is what we do is we'll say what to expect when you first go in. When you first go in, you have your appointment. You're not allowed to eat from the night before until after your cesarean. You're allowed to drink sips of water, just no food. And then we went in, luckily we were like an early cesarean. We were in the morning, so I didn't have to wait too long for food. So yeah, you go in, they were so nice in there, it's so lovely. They make you feel really welcome, and you go into the waiting triage room first and put on your gown and your socks, and then they invite you in. I'm so sorry. And then they invite you in, and it's really nice. They've got the radio playing. You can request, well, most hospitals you can request for your own music playlist if you like. You can take your phone in. When you first go in though, to get to the spinal put in your back, you go in on your own. I do remember my husband, this was at my hospital, my husband had to wait outside while they took me in, put the spinal block in, and then once that was done, he was allowed to come in. He had to gown up, put like these red little scrubs on and his little blue little hat, and then he came in. If you're worried of the spinal, it was not as bad as I was expecting. I was being a bit naughty because they sit you on the edge of this bed and you got to curl over, and then they put the small injection in first, which is the numbing injection. I need to catch my breath. They put the small injection in first, and then they put the bigger needle in, but you don't feel that because they've already numbed that area. You feel pressure. So with me, I just felt like pressure, like someone was really pushing onto my spine. That is all I felt. But I kept swinging my legs because I was nervous, and they were telling me, you got to keep still. I was like, oh my god, yeah, because this is serious. Like, you have got to keep really still so they can get it in the right place. And also my spine also leans to one side, so I've got like a tilted spine. But yeah, no problems, no complications, nothing after either. I didn't felt like I suffered with any spinal complications afterwards, like twinges or anything like that. Pain wise, yeah, it was just pressure. It was fine. And then once they've done that, they lie you down, and then a husband comes back in, or partner, or your mum, your nan, whoever you want in the room can come back in. So we had the radio on, everyone was chatting away, just being really friendly. I did find, because I'm really small, I did find the numbing sensation a bit, I felt like it came up too high on me, so it felt like they numbed me right up to here. So I don't know if I'd mention that next time, just like if they say they're going to whisk me off for or I ended up having a section this time around, which hopefully, fingers crossed, I don't. But I would say maybe that's what happened last time. But also, they might have just not administrate too much or something. It could have been just my anxiety, because I do suffer from anxiety, so my chest just felt really heavy. I felt I had to take really deep breaths, but that could just be me worrying about the whole situation, and not thinking that they've numbed me too high. But anyway, that was fine, and you don't feel anything. I don't remember feeling anything. Music was playing, everyone was talking, and then before I know it, the baby was out. She was crying. It was so nice, and you really don't feel. You just feel like tugging a bit, but really not even that. And it was really lovely because the song there was a song that kept playing on the radio, like mine and my husband's song, the Ed Sheeran song, we kept like playing in my pregnancy and stuff, and then literally as she was born, it came on the radio and played, and I would never forget that moment. It was so lovely. So then she comes out and all is good. They put her on my chest. Midwife took a lovely photo for us, so do take your phone in or camera in. And then, yeah, they just sit you up, which you can't feel anything of that either. You're just lying there for another 20 odd minutes, just waiting to finish. And then you get put on the ward with the other mums on the ward. And yeah, obviously they do put a catheter in as well. Once they've done your spinal, they will put a catheter in. So you don't have to worry about, obviously, because you can't feel anything when you're going for a wee. And they do come around, so like your dignity goes out the window when you have a C-section, because they're coming around, they're changing, because you can't move. And I can't remember how long I couldn't move for. It was still a good few hours, and they have to change, obviously, the pads and keep you fresh and change your catheter, which is really unpleasant. I kept saying, I'm so sorry you have to do this job, to the midwife, and she was like, it's my job, it's absolutely fine. But I still felt like embarrassed. Yeah, so that was fine. The biggest tip I could say is to get moving straight away, because that night the midwife said to me, look, if you can get up and try and do a lap around your bed, it will benefit you. And I remember there was a woman opposite me, bless her, she really didn't want to do it, and she didn't do it. But I did do it. I did try, and I found that I healed better, and I got up and started moving quicker, and just help the process along. So I would encourage you to get up and try and just shimmy around the bed, so you've got the bed to hold on to, just go around the bed, and everything. And then I think the next day is when they took the catheter out. I'm pretty sure they didn't take the catheter out that night. I'm pretty sure they didn't, but they might have. But then they take the catheter out when you're ready, and then you have to do your first wee, which is a really weird sensation, and you feel under a lot of pressure actually to do this first wee. But biggest tip is as well, another one, well actually no, that's for VBAC with normal birth, is to just spray your bits when you're going for a wee, but you don't need to do it for a C-section. But yeah, so once you've done a wee, they have to check that. I think they have to check if you do the number 2 as well before you're allowed to leave. But I had a lovely shower, and they say you can shower. Some hospitals say don't bath for a good 6 weeks after a Caesarean, but my midwife said I can, but don't soak, because I didn't have a shower at home, I just have a bath. So I just remember having a quick dip, wash, get out and dry, and make sure you dry that scarring. The scar area is like, just make sure you dry it really thoroughly. Everywhere is dry before you get changed and everything like that, and change dressings and stuff. But big tip to take to the hospital would be peppermint capsules or peppermint tea to have afterwards, because you get quite a lot of bloated gas where they've had you kind of open, and then you like, your stomach is getting cut 7 layers down, so you feel with a lot of trapped gas and a lot of trapped air. So peppermint capsules and peppermint tea is a must if you're going to go in for a planned cesarean. What else could I mention? Don't miss your medicine. So if you keep on top of your medicine, I think I was on paracetamol, ibuprofen. But if you can keep on top of it every 4 hours on the dot, don't miss it. Because I always remember I was fine. Yes, I was sore, but if I kept up on my medication, it was bearable. But if I missed that 4-hour mark, oh, didn't I know about it? So keep on 4-hour mark. Just keep on that medication. Now also it's required to have the blood thinning injections after you have a cesarean. I don't know if that's the same for you, but mostly in the UK you do here. I must admit they're the worst bit about the whole cesarean is these blood thinning injections. I had to get my husband to do them. If you are on your own at home with a baby and you haven't got anyone to help you with them, you might find them challenging, but you might be okay with them. But for me, they were awful. They were horrible. I just recommend pinching the skin first and then just going for it and slowly put the liquid in, because it's the liquid that hurts. It's not the injection. The injection doesn't hurt, but it's the liquid. So yeah, it is a pain. I personally, if I was going to have a cesarean again or went in for an emergency cesarean, I would just request the socks and I would not go for the injections. I would see if I cannot have them, because I think they had the compression socks before they had these injections, and they were suitable for all these years. So I think it's personal preference, and if you don't, you might get on with them absolutely fine. They do leave bruises, so alternate on your legs or your belly. I'm going to be honest and truthful with you. I did not like them. That was the worst thing about them. But it is recommended to have them and to do them. And if you've got someone there to give them to you, then that's a lot more better. But it's totally what you do with them. But unfortunately, that's what we have to have now. And it's just, and also you have to have them if you get COVID as well. If you get COVID, some people have to have those blood thinners. And they're just nasty. They're not very nice. But don't let that worry you, because people say put some ice on the area first and that helps a lot. So that's a good trick that I didn't know back then, is just to ice up the area and really give a good pinch on your skin before you put it in. So yeah, the other tips I would say is, if you're going to cough or sneeze or laugh, is grab a pillow, put that pillow on your belly and hold down and then sneeze or cough. Or if someone's making you laugh, you just need to cushion that belly, because it is quite sore afterwards. So I think the first week is the hardest. Like day 1 and 2, you're not so bad, and then 3, 4, and 5 and 6 kind of must be when the body is really trying to get back at healing itself. So it was quite intense those days. So I remember trying to get out of bed in the middle of the night, and it was really painful. But then you're sleeping through the night, so you're not really taking your meds. I would probably even suggest setting an alarm just to get up to take that medication on the dot through the night, because I think that would help massively. But then once week 1 is out of the way, by the time you get to week 2, I found that I was feeling good, and I was like, wow, this is not that bad. This is okay. Some people can suffer quite a while, and some people are feeling great. And then they do say though, you'll feel great, and then don't go and push yourself and think, oh, I'm just gonna crack on, because I did that and it hits like a ton of bricks. So remember that you may feel fine, but there's still lots going on inside. So really take it easy and try and do as little as possible as you can. If you've got someone that can be around you for the first 2 weeks, it would be really helpful. because it's just you're going to need at least 2 weeks to try and get some help. And I take my hats off to any mum that does this without anyone at home after a C-section, because it just must be so challenging. So you're superheroes. I'm just trying to think, because I didn't make a list for this video. I had a spare bit of time just to quickly get a video in. But pillow, the peppermint, I've said, the keeping it really dry, that area, just keep it super dry. And if you get any red, burning or itching, call your care team afterwards. You don't want to get an infection or anything. Some people like to wear tummy bands after for a bit of support. I didn't back then, but I would if I had to have one again. You can get like these tummy wraps just to hold it in. And I've just bought some really supportive leggings for after birth, just to feel like my stomach's got a bit more control and like snug, sort of hold all my tummy in basically. So just don't be afraid of the cesarean. It's fine, it's planned, it goes really calmly, it's really smooth, everyone's really friendly, there's no rushing around. That's the nice bit about it. You know when it's going to happen, and it's the recovery. And if you are doing it on your own, it's going to be hard. But you know, we can do it. Well, us mums can do it. And yeah, I've said all the main tips. Just keep up on your meds, put a pillow on your belly when you're gonna sneeze, and I'm just trying to think if did I pack anything different in my bag for a cesarean? Not really, just a few more clothes, because you could be up there for like 3 days instead of like 1 or 2. Some hospitals want you to stay in a bit longer. So just pack more of everything. Pack your home comforts, pack your dressing gown, then your pillows. I always suggest taking a pillow from home, wherever it's a V pillow, a feeding pillow, your normal pillow, because you're going to want a lot of comfort while you're there. But yeah, so maybe to make it you guys feel, if you're planning on having one, make a playlist or something. If you're really nervous about it, make a playlist to pop on of your favourite songs to play while you're in there. Get your cameras, make it, or ask to see them. Sometimes they can even pull the curtains down. I think with mine they just lifted over the curtain. You can have them to pull the curtains down if you really want to have a really good sort of like look, just whatever's going to make you feel comfortable. Then yeah, so good luck to anyone that is having a C-section. That was mine, and it went quite smoothly, and I was feeling good after 2 weeks. I was very lucky. The scar was nice, small, and it's healed really well. Just keep an eye on the scar. That's the main thing. And don't push yourself. You may feel good after 2 weeks, but no, you're going to need at least a good 5 to 6 weeks to feel really well again. And even down the line, like a few months after, doing anything heavy, like say like 8 months down the line to a year, sometimes I think in the first year I felt like, oh, that was a bit pulley, because you are having a massive abdominal surgery, so it needs to be taken seriously, but there's not to be scared of. You'll be absolutely fine. So yeah, that's my cesarean section, a video, and I hope that this gives you any sort of tips and tricks. There's not much you kind of need. You just need to remember the bits that I said, and good luck. And yeah, I'm due to have this one soon, so I need to post my updated video next of me at 38 weeks. So I'll speak to you soon. Bye.